What's up, guys? My name is Dalton and I'm a physiotherapist here at The Movement, and I've seen a lot of people over the last 5 years here at The Movement that have experienced low back pain. It is not fun. If you've ever had it, I know you can relate to this. But today, I want to share with you 3 exercises and some progressions that you can use to manage an acute low back pain flare-up. Now, let's dive in. So, the first thing we want to get off the top here is that there's always going to be responses that are different from different people. You may respond differently than I respond. This is just a good general framework of movement that I've found to help people with some generalized low back pain. When you have that back pain flare up where you're having trouble bending over, you're having trouble arching, you're having trouble rotating, everything really feels pretty crappy and you're looking for a way to get some improvement, I find these exercises and some of the progressions I show you will be a great entry point into being able to start the rehab process and get things going. So the first thing that I really like to start with is called the child pose rock back. So what that's gonna look like is we're gonna come down on the floor, we're gonna have our hands on the floor in the 4-point position, and we're just going to slowly sit back towards our butt, get a nice stretch through the low back, and then come forward. And we'll repeat this nice and controlled. The reason why I really like this exercise is it starts to get our back bending in a nice, safe way, and you're in full control of this movement. So if your back is really sore and it's not liking going all the way back, you're able to stop that wherever you feel comfortable. And to be honest, maybe starting out, you're literally only going to be able to get this much movement, but that's okay. Because over time, if you're nice and gentle, that should open up and give you a little bit more freedom to move through the back. So I really, really like starting out with that and implementing it right away as much as you can tolerate. I usually like to aim for about 10 reps, but honestly, the reps aren't as important as the frequency in which you expose your back to that. So maybe you're getting down to the floor, you're doing 3 sets of 10 reps, and you're doing that every hour, on the hour, a couple times a day. The key with these things is to keep the back moving in ways that feel good and avoid just being stuck in one position. To show you a little bit of a regression of this exercise, if you find that that is even too challenging for you to start, what we can do is we can come onto the floor, lying on our back, and we can do just a knee to chest. So we're bringing that knee up, we're grabbing it with our hand, we're pulling it forward, and we're just bringing that knee as far up to our chest as we feel comfortable. This is a good way to start implementing some low back flexion into your movement that might be a little bit nicer than the child pose. If the child pose doesn't feel so great, try the knee to chest. If the knee to chest doesn't feel so great, try the child pose. See if you can find some type of entry point to that, okay? The next movement that I really like to implement to work on some extension of the back, which is another position that gets a little bit bothered when we are sore, is some type of variation of a classic exercise called the bird dog. So the place that I really like to start with this is the simplest, most regressed version is we're using a slider. We're in a 4-point position, kind of similar to how we were with the child pose. And all we're gonna do from here is we're literally gonna straighten our leg, come forward. Straighten our leg, come forward. This is gonna start to get some gentle extension through the back. Not a crazy movement, but is gonna get some movement into common positions that we find are really sore. Same idea, you could start with 3 sets of 10 reps or whatever you can really tolerate at this point and slowly build on it. I think the key is to be frequently implementing these movements throughout the day so you're not getting super stiff and not getting super painful. A way to progress this is we can remove the slider. So we can come into the 4-point position without the slider, and we can try just extending that leg back. Now this is going to be a little bit more challenging. It's going to put a little bit more load through your back. Obviously, as you can see, you're lifting your leg off the ground, which is going to put load through your back, your core, all of that. But if you are tolerating it, it's a good way to start exposing your back to a little bit of extension. And I'll show you how, right? This is going to be a little bit of an exaggeration, but as we straighten our leg, our back is going to extend as we straighten. I'm exaggerating this position right now so you can see the arch of my back. But if we straighten, we know we're getting a little bit of extension-based loading there. This is going to be a good way to start getting that movement into your routine. The next thing we want to do is try and progress maybe a little bit of how we're loading the back. Now, if you're super sore, you're super acute, this just happened, maybe just doing those two things is enough and a good place to start. But if you're feeling good, that feels okay, maybe you're progressing through the rehab, another variations of movements that we can implement to help with both bending and extending through the back is as follows. We're gonna do very simple, but a squat to a target. So one thing that happens when we are in pain with our back is we don't want to flex forward. So what I see a lot of times with people who are focusing on getting up from a chair or from a squat position is they try really hard to keep their back straight, which probably feels a little bit better. One way we can start working on improving that is by doing a controlled sit to stand. So right now I'm doing it on this bench, which is kind of low, but you could do it on a chair, you could do it on the bench with pillows stacked on it, you can elevate the height to find a height that feels comfortable for you. But a key is starting to get a little bit of flexion loading into your back. So what I mean by that is trying to bring your nose over your toes, which is going to put the weight underneath you. We're gonna stand up, and then we're gonna control back down. Now I know this seems very basic, and that's because it is, but it is a common position that we find a lot of people get pain in. Like I said, one way you can change this is we can elevate, right? So if that depth is bothering you, we could add a mat, we could add a textbook, you could add whatever you can find so that we're higher up and we're maybe not getting as much forward loading. It's gonna feel a little bit better. So the key is trying to find where the entry point is for you. So trying to find something that is nice for you to do a squat or a sit to stand, trying to get a little bit of flexion loading in through your back. The other thing we can try is bending forward or hinging. So you might have heard of a deadlift or just even bending over to get something off the ground. That position is very uncomfortable a lot of times when we are in a lot of pain. So one way that I like to try to start to expose people to this position is a kneeling position. So we might start here and think about pushing our hips back towards our butt and coming back up. So this is gonna, again, start to expose you to a little bit of flexion and extension based motion. So the more I kind of sit back like this, the less kind of hinge motion I'm getting, the more that I'm thinking about pushing those hips back, the more of the hinge position I'm hitting. And so trying to find for you where that entry point is going to depend on how you feel. So trying those things out to try to find, okay, where can I tolerate this? And kind of similar to the other movements that we talked about, trying to aim for 2 to 3 sets of 10, but honestly, whatever feels good. At this point of low back pain, all we want to do is try to start to expose the body to the movements that are sore in a safe, nice, gentle way so that we can start to move you through that acute phase of rehab and into the build it up phase of rehab, which is where we might start to increase the level of intensity of movements, which that'll be a separate video that I'll take you guys through. But those movements are probably my favorite to enter into some flexion and extension. I quickly want to show you how to implement a little bit of rotation movement, and then we'll wrap this video up. So one way that I like to do that is coming back down to the floor, and on our back, we're slowly going to rotate our knees. This is going to allow for us to get some rotation through the back in a safe way. And again, you are in control of this movement. So if you just go a little bit and that's all you can tolerate right now, totally fine. Slowly see over time, can I get a little bit farther and a little bit farther? So that is one way we can implement some rotation. The other way that I like to do it is common like mobility exercise that you might see. It's called thread the needle, or thread the needle with a rotation. And so what that's going to look like is we're coming back down to that trusty 4-point position. We're going to reach through, and then we're going to rotate up to the ceiling, and we're going to repeat that. So this is commonly used for more of like a thoracic mobility drill, but I really like it for starting off some low back pain because we are going to get some rotation through that lumbar spine. And it's a little bit less aggressive than some other rotational exercises. So if you can't reach through and rotate all the way up, maybe all you're doing for now is just reaching through. And again, you're going as far as your back's going to tolerate. If you can get far into that, great. If you can only get a little bit, that's also okay. We just want to start exposing the back to a bit of movement. So what we covered today, we covered the child pose, we covered the knee to chest as a regression, we covered the sit to stand. You can modify that by changing the height. We did the kneeling hip hinge or bend over of the back for extension. And then we just covered the rotation movements of lying knee rotations and then thread the needle with a rotation. Those are all great options for you to start off exposing your back to a little bit of movement following a bout of acute low back pain. The last thing I'll say about this is back pain sucks. Like, it doesn't feel good. I've experienced it. I know about back pain and it still sucks. So if you're going through this, I totally understand. I totally feel you. But the good news is that most back pain gets better if it's managed the right way. So I know all of us have someone in our life that has probably experienced low back pain and still dealing with it, and it's not gone in a great way. A high percentage of back pain gets better, and it gets better fairly quickly. And these are great ways to start helping that rehab process along. So try these out. Let me know what you think. If you have any questions around the acute phase or the early phase or the calm it down phase of low back pain, put it in the comments below. You can reach out on Instagram at the Movement PTs, DM us. Be more than happy to give you some guidance. I will make another video showing you what the next phase, the build it up phase of rehab would look like for something like this, and how we're gonna start loading the back a bit more. So stay tuned for that. Make sure you share this with a friend who's going through low back pain. Make sure you subscribe, all that fun stuff. Thanks for tuning in. We'll see you guys in the next one. Peace.